So I'm a primary care physician at a federally qualified health center in New Haven, Connecticut. Day in and day out, at every clinic visit, my patients are experiencing difficulty affording the healthcare that they need and the healthcare they deserve. Not only are they not able to see me as often as they need to because of cost, they're oftentimes not able to afford the medications or other treatments I prescribe for them because of their costs as well. They're making trade-offs that are unacceptable between affording their healthcare and also being able to live just generally, paying for rent, paying for food, being able to pay for their family's needs. And so it's becoming increasingly worse, especially as we see policies being enacted that's stripping away the limited healthcare access they even had available to them in the first place. I think, first of all, I was heartened that there was so many different stakeholders, from hospital leadership to clinicians to patients to people who just work in the healthcare industry writ large, who are willing to think about healthcare affordability as a core part of their mission. The methods, in terms of how they want to address this, are all different, but there was at least a willingness to kind of come together and think about solutions together in terms of addressing the problem. The other part that I thought was really interesting today is that there is increasingly this sort of voice about corporatization of medicine and corporatization of healthcare and how that intersects with costs or it's contributing to high costs. That's becoming louder and louder. And so many people today across the different tables that I went to, the different people I've spoken to, have talked about how healthcare corporations are really impacting and driving healthcare unaffordability, and the need to regulate those corporations to be able to ensure that our patients are being put first in the healthcare system.